I'm with Dr. Jack Schaefer with Schaefer Eye Center, and today we wanted to talk to him about lenses and the variety of lenses that are on the market.
Yeah, it's amazing. Today's people get glasses and don't realize that what's in the glasses is probably the most important part. And there's so many different levels of lenses today.
Well, talk to us about the special tool that you have to really help fit folks with the right lens.
Well, remember, it's not just about the lenses. Also, make sure they're in the right place. And in the old days, we used to measure patients. We take a stick and look and close your eyes. Now, we have computers that do just a great job. So we can actually mark where they are straight, the eyes, where they are to the left, where they are to right, and lenses are custom made for that patient in that particular frame. So even though this lens may be great in this frame, and we may need another lens, the computers say, no, let's use a different lens on that patient where they have less distortions.
Talk about progressive and bifocals.
Well, again, the new progressive lenses are just so wonderful. There's really no reason to wear bifocal anymore. The new progressives have no distortion. And I say no, I mean really no distortion. Now, again, those are getting more expensive. If you buy a progressive lens and you don't pay very much, chances are when you look at the corner of your eyes, you'll have a little distortion. But on the new lenses, and with the new lenses, the only way you can order them is because they have to be so precise in exactly where down the center of the eye.
Now, do all lenses have the anti-glare factor?
No, they don't, but you should have it because
Okay.
100% of light will go through versus about 96%. And nighttime, we know that people just don't see as well. You know, we all know that night vision is just not as good. When you put the reflective free on the, we call anti-reflective coating on the lens, all the glare is gone, all lights and for other things, and it lets a lot more light in. So really, today's glasses need anti-reflective coating. They need UV protection for cataracts and macular degeneration, and of course the proper measurement to make sure that they just fit that patient perfectly.
Well, what about HD vision and 3D? What does that mean?
Well, 3D is a whole new area that we're all looking into, but all these new lenses are called HD type lenses because we have something we call wavefront aberrations. Everybody sees, like when you look at a light, the light that comes off of the reflection come off the light. Well, we know there's lenses that reduce that aberration, okay? And these new lenses just do such a great job, so that gives you a little more high definition vision.
Okay.
3D is a whole different world that we'd have to take a whole new show on.
Yeah, okay, we'll have to come back and talk to you about that, right?
Absolutely.
Anything else that's really important to note about coatings, that kind of thing with your lenses? Or tell us, how long does it take them to come back?
Well, that's the problem. These new lenses take a while. You know, they take 5 to 8 days to get a pair of glasses back because they're custom made for that patient. It's impossible to do this on an inside lab because, again, equipment alone to make this type of lens is extremely expensive. It's all robotic, and that's the only negative. It takes a long time. But if you have the right lenses with the right frame and they stay in adjustment with the right coating, you are giving yourself the best possible vision you can ever have.
It's well worth it, right?
Oh, absolutely.
We all want to see as best as we can, I guess.
And be safe. So clarity is the name of the game when we're talking about lenses.
All right, Dr. Jack Schaefer, thank you very much.
Thanks for having me.